Natasha, good morning to you. Thanks so much for your time. What exactly do you want the Ethics Committee to investigate?
Well, what we need the Ethics Committee to look at is whether or not the fact that Minister Dlamini Zuma stated on more than one occasion, once during a live TV interview and once during a parliamentary committee, overstated the fact that a certain amount of people had supported the ban in cigarette sales. As it turns out, this number was completely incorrect. And when one took the total amount of submissions that the minister actually received, she claimed to have over 2,000 submissions in favor of the ban, and it turned out that only about 450 supported the actual ban of cigarette sales. So, as you know, MPs and ministers are held to a very high ethical standard in terms of telling the truth and being truthful with the public. And we'd like Parliament's Ethics Committee to investigate whether or not the minister in fact misled not only Parliament but the people of South Africa regarding the amount of submissions she received in support of the tobacco ban.
Have you asked the minister for clarity on why she had initially said they received over 2,000 applications initially, those inputs from South Africans, and less afterwards?
Clement, in cases like this, you wouldn't ask the minister for that kind of clarity. That clarity is sought through the Ethics Committee, and there are mechanisms in Parliament in which we require ministers to answer, one of them being the Ethics Committee. So we leave those questions to be answered in the Ethics Committee, because that makes sure that it's done in a free and transparent manner and in a manner that is completely fair to the South African public.
And the conversation that would then follow is whether she would have done so deliberately and just didn't have, or maybe just didn't have the right information at the time when she made the initial comment. What do you think was the case here in the context of how government has been dealing and giving reasons for the continued ban on the sale of cigarettes? And of course that about turn where we had the president announce that the ban is lifted, and then later on have the minister come and say government has now decided to reinstate that ban.
Clement, look, I think it's an interesting one, because certainly the decision in all circumstances seems to be an irrational decision. So there will be a lot of explaining that has to be done, and certainly an explanation will need to be given for the backtrack. You're quite right that there was a very big backtrack, given that the president had announced that the ban would be lifted. But just quickly, back to whether or not the misleading was deliberate or accidental, that's actually irrelevant in the parliamentary circumstance and with regards to public reps. And I use the example of Minister Lynn Brown, who answered a question in Parliament that I asked her about Eskom, which led to an entire investigation being done in Parliament regarding state capture at the state-owned entity. And the reason then given was that ministers have a duty of care to ensure that the information that they produce to the public and that they produce to Parliament is 100% the truth. So there is no room for manoeuvre in saying that it was accidental. The minister has a duty of care to produce information to the public of South Africa that is correct.
Let me get your thoughts also, Natasha, on what we've heard the health minister say this morning from the Chris Hani Baragwanath Hospital. He's calling on different stakeholders to work with government here. He says, let's stop fighting about and against the regulations. Everything that we've had to implement was there to protect each other. He's mentioned the ban on the sale of tobacco, and he said we're doing it because we want to protect each other. What do you say as the DA?
Clement, I certainly think that, I like to work in the best interests of South Africa, and I like to believe that everyone should be working in the best interests of South Africans. I also want to protect as many South Africans as I possibly can, but in that I also have to protect the rights of every South African. So strictly speaking, if we were going to enter into this way of thinking that it's the government's duty to protect all South Africans from every possible measure of harm that could come to them. In that way, then the health minister would be saying that he's going to be banning sugar, because we all know how dangerous sugar is and the effects of diabetes. And we also know that when it comes to the COVID-19 epidemic, all studies are showing that diabetes seems to be the highest comorbidity of the disease. So certainly then we should be looking at banning sugar. Now that in itself is completely irrational and would never happen. So I think we have to be very careful when we start infringing on one another's right to decide how we protect ourselves, and certainly what substances we intake, including tobacco, including alcohol, including sugar, and let South Africans as adults make the decision as to how they look after their health in terms of what they consume themselves.
All right, Natasha Mazzone, the DA Chief Whip in Parliament, thank you so much for your time this morning.